You know, when a couple comes to us, we don't assume that it's the woman or it's the man. You know, we assume they're a couple. So we're going to look at all the factors that, cause problems with fertility. If you really look at it, 40% of infertility is due to the male. So one of the most important things we can do is a basic semen analysis to evaluate the male. As far as the female goes, we have a pretty standard workup that looks at about 70% of the factors in 1 month. If they have regular cycles, we're going to ask them to come in on the second or third day of their cycle so we can do a hormone evaluation and an ultrasound. This will give us an idea about what we call ovarian reserve or reproductive age, which usually is consistent with chronological age, but not always. Once that's completed, if they haven't had something to evaluate whether their tubes are patent and their uterine cavity is normal, we're going to perform what's called a hysterosalpingogram. Most of the specialists, actually, we perform the test ourselves rather than send you to a radiologist. It's much more comfortable, it's a dynamic exam, and we can give feedback immediately. Once that's completed, we're going to look for ovulatory status. A lot of times it's easy to have somebody start an ovulation predictor kit about the 10th to the 12th day of their cycle. When they have that color change or an LH surge, they can have intercourse that night, and we can check the next day to see if the husband's sperm's motile in the cervical mucus. Just gives us an idea. And 7 to 9 days later, we can measure a hormone called progesterone to see if the woman's ovulatory. We're also going to check the female's thyroid, a hormone called prolactin, because they have to do with reproduction. And we're going to evaluate the couple for all the genetic factors that might need evaluation in terms of screening per certain ethnic groups. And this gives us a basic workup and allows us to direct our treatment or further diagnostic testing where we need to go.